Hello and welcome to the 76th World Health Assembly. We're coming to you live from Geneva, Switzerland. I'm Vismita Gupta-Smith, and behind us at the World Health Assembly we have delegates from 194 countries, public health experts, partners, policymakers, all of them deliberating the agenda for health for the world. And we have a very distinguished panel here with us in this live that's coming to you on WHO's Facebook, LinkedIn, and Twitter channels, also on YouTube channels. So we are going to talk about the future challenges of health. This is the year when WHO is observing its 75th anniversary. We are telling the stories of how the world came together to solve so many health challenges in the past 75 years with science, solution, and solidarity. But in this conversation, we are going to ask our experts about what they think are the big health challenges of the future. So let me invite you also to use hashtag AskWHO on our channels. Ask us your questions. I'm going to introduce you to our experts now. Let me start from you. Dr. Maria Neira, WHO Director, Department of Environment, Climate Change and Health. On my left, Dr. Krishna Uday Kumar, Founding Director, Duke Global Health Innovation Center, and our very distinguished Honorable Health Minister of Bhutan, Dasho Dechen Wangmo. Welcome to you all. I'm going to start with you, Maria. First, talk to us about what you see as the big health challenges that the world must now face.
Thank you, Vismita, and it's really a pleasure and an honor to share this table with you. As Vismita was saying, behind us there are big negotiations, big discussions, and probably from those discussions there will emerge as well what are those big challenges that we need to face in global health. For me, clearly, and we just been discussing on a roundtable, a strategic roundtable, pollution. I mean, pollution and climate change are one of the big challenges that as a society we are facing. And pollution, only pollution, is killing more than 7 million people every year. Imagine the air we are breathing, the pollution we have around us is responsible for more than 7 million deaths, and this is definitely one of the big challenges that we need to face. The other one is climate change, but obviously climate change is a crisis that will be undermining all of our achievements on climate, on health, putting at risk our health systems, for which we need to make sure that we will create the resilience and the capacity we need on the health systems to face climate change and the crisis that would represent biodiversity loss, so connected as well to our global health. Not to forget non-communicable diseases, still the unfinished agenda of infectious diseases, the big problem of mental health, and of course we need to make sure that all of those crises are not putting at risk what we have been achieving until now, like reducing maternal mortality. We need to make sure that we will get older on a healthy way, so a healthy aging will be fundamental as well. And we need to make sure that obesity will not, and sedentary lifestyle, those two lifestyle-related issues will not undermine again all of those efforts and big achievements that we had until now. I think we have so many challenges to discuss, so let's put it there.
Let's start with that.
And maybe we can add others later.
Right, let's start with what Maria put on the table. So let me come to you, Health Minister Dechen. People of Bhutan, for people of Bhutan and many other countries in the world, climate change is not something that's going to happen in the future. You're already facing its consequences. Talk to us about how the government and people of Bhutan are, what are the challenges that you see, and how are you planning to tackle them?
Thank you. It's a great pleasure to be here on this forum. I think when we look at climate change, I think for climate change we have to have this shared solidarity and collective effort. Bhutan can only do so much as one country. Bhutan, of course, as many of you will know, that Bhutan is the only negative carbon country in the world. We have almost 70% forest coverage, but we are doing our part. If the rest of the world are not doing their part, then ultimately disease knows no boundaries. Pollution, for example, knows no boundaries. Microplastic issues knows no boundaries. So this is where I think there has to be a collective effort first. Second, I think when we are talking about climate change or climate-related diseases that are going to come up, climate-sensitive diseases that are going to come up, I think many health systems are not ready to deal with it. So there has to be a greater investment in making our health system resilient, making our health system efficient, so that we also understand and have the capacity to deal with climate-sensitive health-related issues. And I think that is a conversation that needs to happen not just in the country for the political leadership, but will have to happen at the global level to garner political support, because without that I think it will remain a discussion with not much of action.
I want to come back to this disproportionate vulnerability that countries like Bhutan and many other countries face from climate change, and we'll talk about that in a minute. But let me come to you, Krishna. So the pandemic flagged to us how vulnerable we are to misinformation, to attacks on science, and it's come down to almost all of our families now, where we are a deeply polarized world where everybody is equally assured of them being on the side of the fact and the truth. So talk to us about trust in science, trust in health institutions.
Sure. First, such a pleasure to be with you all today. Thanks for the opportunity. And you're right, whether it's climate, pandemics, health more broadly, a lot of this really comes down to trust as the major driving issue. And what we're starting to see is that while trust in institutions broadly have declined gradually over decades, there was a big hit in the last several years of the pandemic. We're seeing a lack of trust at that individual and household level, like you mentioned, a lack of trust between individuals, communities, and public health institutions with their own political institutions, but also on a global level, lack of trust between the global north and the global south, just seeing how inequitable the response to the pandemic has been. So there's a lot of work to be done. And what we have started to do is to try to understand what are the levers to actually find solutions to this issue of trust. And as you pointed out, a large part of it is being driven by misinformation, disinformation from all sorts of sources, in some cases from public officials as well. And to be able to fight it, we've done a lot of work, including with your colleagues here at WHO and others, and starting to look at this idea of 3 C's. What are the 3 levers we might be able to pull on? One is community, the second is communications, and the third is competence. So if we think about communities, how do we empower communities again to feel like they have the ability to create accountability to their own institutions and their own governments? The second, around communications, how do we make sure that all of us that are communicating health information have the skills, the tools, and resources? But also, how do we get better at the communication science so that we understand things like risk-based communication? And thirdly, competence. So are we building a system where the institutions and the individuals are actually delivering what they're supposed to? Are we trustworthy in order to earn that trust by actually delivering quality and timely services? And we think that this combination of these 3 C's can help us find a path forward where we're starting to rebuild trust across all of those different areas.
So let's talk a little bit about this building resilient communities. I'll come to you, Maria. Resilient communities for climate change. How do we get there?
Well, the countries and the health sector is already very negatively impacted by climate change. We see more infectious diseases, vector-borne, water-borne. We will see more mental health cases. We will see more non-communicable diseases. We will see heat wave-related injuries and death and suffering. So all the diseases will be at risk. So we need to have a common approach to make sure that our climate, our health systems are climate resilient, to better cope with all of those efforts and diseases that now there will be increasing. The only solution is to strengthen the capacity of the health system, making it more resilient, making it more climate sensitive, and of course creating basic investments which are no regrets investments to better prepare those health care facilities. In WHO we have launched this approach initiative called ATTACH, which is the Alliance for a Transformative Action on Climate Change and Health, as a result of the COP26 Glasgow health commitments. This platform is bringing now more than 67 countries, and we will provide all the building blocks for what a climate resilient, low carbon, sustainable health system means. For some countries in Africa or in other places, I mean low income countries, they are not contributing to the carbon emissions. So the only thing they need to do is to gain access to energy sources, but clean energy, renewable energy, not polluting energy. And for those countries, medium and high income, that are already contributing to the carbon emissions, because altogether the health system is contributing to 5% of the global carbon footprint, we can decarbonize our health system. We can be more efficient in the way we use our energy. We can transition to clean sources of energy. We can reduce packaging, plastic use, all the supplies being environmentally friendly. And this is all the knowledge that ATTACH is going to give us. And that's why we invite all the countries now to have this capacity to do vulnerability assessment and then putting in place the climate resilience healthcare facilities, health systems. And for that, of course, we need financing as well to make sure that we respond to this major crisis that is created by climate change for our health systems.
We're getting a lot of questions now, Maria. Let me read out a few comments and questions for our panel here. Dr. Frederick on LinkedIn: we can do so much against pollution, renewable organic energy, no cars, no flights, no fossil energy, and even more is necessary. Nishant Narang is not very happy about what governments, global governments are doing. And he asks, yes, agreed, but what are global governments doing about it? Nothing. And on top of that, planting more manufacturing plants causing emissions, polluting industries. So he wants to know what are we doing, what are governments doing? I think you gave some examples, but if you could address that. And the final question for you in this batch, Maria, which countries are the most vulnerable to the challenges of pollution and climate change? I'll take an answer from you and then I'll come to you as well about vulnerability of Bhutan.
Thank you, thank you. I mean, I agree. I mean, the world in general, the global community, any government, we are not responding to the magnitude of, at the level of the magnitude of the problem we are facing. So yes, I agree. The decisions are there, I mean, the interventions are there, but the level that the climate change crisis represents, the risk for health, or the pollution, the risk that it represents for health, we don't see the responses at the level of ambition that the magnitude of the problem represents. We need more speed and more ambition in the responses. And this is for all governments. We need to reduce emissions, as simple as that. We need to reduce emissions. We need to look at where those emissions are coming from, and then we need to reduce it and to move to a more sustainable green development. That will be so beneficial for health. So what we are doing, we are raising our voice, we are using the health argument to remind everyone that this is not just about mountains, glaciers, polar bears, planets, and environmentalists and Greenpeace people. No, this is about health. This is affecting our health. So because it's affecting our health, the health of the voice of the health professionals needs to be very, very strong. Taking it to the COP and the negotiations, we are very happy that we can announce that for the first time ever at the COP28, we will have a health day. So, and a ministerial of ministers of health coming to the COP. So we will put the health arguments, how climate change is already affecting our health, how much the health system is already paying, the cost that is paying to face that, and more importantly and in positive, what are the huge benefits for health we can obtain if we reduce emissions, if we tackle the causes of climate change, particularly moving on from the combustion of fossil fuels.
Thank you, Maria. The changes that you're talking about will actually take systemic changes in our economies, how we look at economies, how we make that shift from economies that are focused on profit to economies that look at well-being, and that takes a lot of political will. So let me come to you, Health Minister. Talk to us about the government actions, successful government actions that your country has taken to address these challenges.
I think for Bhutan specific, first of all, I think climate, biodiversity, going green has always been on the top agenda. We are mandated by the Constitution to have 60% of our forest coverage at all times to come. Our energy, as you know, is renewable. It's clean energy. We use hydropower and because of the geography of how we generate hydropower, it is a very clean energy. But I think when we really talk about what Maria was mentioning in terms of political commitment and the will, I think we have enough targets and we have enough strategies and approaches that are science-based at the moment. But my only thing is, have we translated those policies into empowering communities so that they take ownership of this crisis? As Doctor mentioned, in terms of communication, it's so important because we talk about COP. Every year we talk about COP. But I'm looking at a village in Bhutan, a remote village, Lunana, which we had a very long discussion in during the COP meeting as well. It's a glacier-sensitive community. And when I go and talk to the people there, they say, oh yes, it's changing, the weather patterns are changing. But do they really, they have no idea that this could actually impact their health as well. So this is where I think the communication is very important, so that it's through these communication that we empower our communities so that they will make these decisions to come together and take action. Because otherwise the action will stay limited to the boardrooms and the meetings that we have annually. But these deliberations and the provisions do not translate to actions in the community, because there is a huge disjoint between what is decided at a high level versus what is happening in the communities. And I think we must empower our communities so that they are on our side and they become the voices, they become the implementers of what we are trying to do. So just now the global targets are mostly, even in Bhutan, is no exceptions. We talk about it, but then I think at the lower level, I think it's not there. COVID was a success for Bhutan, for example, because everybody knew wear masks, maintain distance, because the messages were consistent based on science. And I think we have not done that level of intensive messaging for climate change. And we all know that if we cannot address climate change now, we miss this opportunity. But yet again, these communications have not come in a most comprehensive way to make behavior change.
Right. Thank you, Health Minister Dechen. So let's stay on community and the 3 Cs. We have a question for you, Krishna. How can WHO and partners help countries to build 3 Cs to better health care delivery systems? This is from Veronica Douglas on Facebook. And also talk to us about, and let's also, when you explain that, talk to us about communities and how to build that resilience against misinformation, disinformation.
Sure. Well, first, I think WHO has a critical role to play. It's really the normative organization for health around the world, but also the network of member states that's so robust. And the idea that you can think about building capacity in health systems, building that resilience in health systems, it's what's going to deliver competency. So when people say, I'm going to access primary care, they know that there's a competent health worker there, and the facilities are of high quality. And it's the same thing you need, whether it's for pandemic preparedness and surveillance, or if it's for essential health services or routine immunizations. So building health systems capacity is, I think, one critical role. The second is this area of communications. I think the WHO has a really strong role to play and has taken that on over the last several years in rolling out really clear science-based messages, both at the global level, but also finding ways to build communications capacity amongst the member states, because it really is about reaching the last mile and understanding where are those trust ecosystems. So where do people go for their information, not just for health, but for everything in their lives? And how do we make sure that we're feeding science-based health information and climate information into those trust ecosystems? And then coming to this community that is really so critical, as we've heard from everybody here. One of the things that we heard in talking to a lot of officials that were responsible at the subnational level for the COVID response is what really needed to happen were understanding and mapping what this ecosystem at a community level looks like, whether it's the village elder, whether it's a community advisory board. You know, there are different formal governance mechanisms this takes, but the ability to understand where are those influential voices in a community and how do we link to them, how do we make sure that they are getting the information they need, are all mechanisms. And we've also seen actually put into practice things like community-based accountability mechanisms, where there's transparency in data, there's reporting back, and our political leaders actually listen to the community of what's happening, here's where we've delivered, and here's where we haven't. I think the examples are there. Now the question is, how do we start to assemble those best practices and try to make them the norm as opposed to the exception?
Thank you, Krishna. So we have a lot of questions and some comments. I'm going to read out some comments and then some questions for you, Maria. Priya Hada on LinkedIn says, totally agree with the view of the health minister. Yes, everyone knows climate change is happening, but they have very little idea about the impact that it has on individuals. Natalie on LinkedIn says, can you show the impact of climate change and increase of cancer? Is there evidence of that? Daniel Clark, can you provide evidence that what you offer as an alternative to the current status quo will reverse or undo or stop climate change? And then Som Sit on LinkedIn, thank you so much WHO for raising the issue of climate change. So I'll stop there and let you answer the question on cancer and evidence.
Okay, let me start with the cancer. Yes, unfortunately, we have plenty of evidence about the impact that air pollution, for instance, is having on cancer. And in fact, among the non-communicable diseases, you know that there are 5 risk factors, and air pollution is one of the most important ones, together with tobacco consumption. So definitely exposure to air pollution is increasing the possibilities of having lung cancer, and we are accumulating evidence now about even other related issues because of exposure to the pollutants that we are breathing every day. Normally, what we do is that we collect evidence, and it's not just air pollution. We are looking now, for instance, at another emerging public health issue, which is electronic waste. You know, the exposure to all of those computers that we are throwing away, all of this electronic waste that we are generating by tons and tons and tons every year, the risk that this represents for our public health is is dramatic. Same for plastics. We are now emerging on the evidence of the microplastics that we are now finding in our body, in our bloodstream, what the risk represents for our health. So definitely on cancer, the linkages are very clear. On the issue of how we communicate as well, the communities and the message that we need to come from the people, that they need to understand. Totally in agreement. People need to understand that if the day is very polluted, your eyes will be very irritated. If you are asthmatic, you will have problems and you will feel it immediately. And this has been a very close connection. People might not see very easily the connection between climate change and health, but they see it with the pollution. They feel it. I'm sure that nobody in India or in Mexico or in many polluted places around the world will not understand the connection between pollution exposure and your health being affected on a way or another. So the trends are not very positive. I'm sorry to say that, but we are definitely working very, very hard to push, to present the health argument, to put pressure on the governments. You have to use your vote as well. We put pressure on mayors as well as the local leaders that can take a lot of measures on sustainable transport, on transition to clean sources of energy, and of course governments, financing, and all as a community, we need to reduce emissions. We need to reduce emissions.
Thank you, Maria. You know, we don't have, it's not easy solutions, but we don't really have an option but to act, right? So I'm going to read the names of all the countries from where our people are asking questions, and then I'm going to come to both of our panelists for their 30-second download on what you would like to say to our audience. Sorry, we're running out of time. So many questions. Sorry we couldn't accommodate all of you. But people are writing to us and watching us from Denmark, Nigeria, Pakistan, South Africa, Kenya, Colombia, Namibia, Nepal, England, Tanzania, Hungary, France, USA, Angola, Ethiopia, Saudi Arabia, Afghanistan, Egypt, the Netherlands, Mozambique, Canada, Argentina, Bangladesh, Syria, Ghana, India, Malawi, Yemen, Tunisia, Australia, Croatia, Liberia, Iraq, Lebanon, and Greece. I'm going to come to you first, Krishna, and then we'll end with a final note from you.
Yeah, I might leave with a simple word of advice, which is to get involved and get engaged, because we really need everybody involved in this conversation. It's not going to be solved as much as we can try to solve here. It's not going to get solved behind us. It's going to get solved really on the front lines in every community in the world.
Thank you, Krishna. Final word from Health Minister of Bhutan, Dasha Dechen.
Thank you. Again, I think we have to look at concrete actions. I see a great opportunity in terms of, you know, just now when we talk about climate change, it is on that day we write an essay, that's it. But I think it has to be part of the main curriculum of the schools. So children learn, but for behavior change to happen, it takes generation. So I think at schools they are learning about climate change, they are learning about implications of climate change. So for me, I think the treaties, provisions and conventions, I think needs to be translated into actions. And I think that not only requires political commitment, it requires advocacy and awareness, like the Science in 5, amazing work. And I think we need a similar things like this so that people are able to translate the science part into something that they can absorb and take action and own it. And I think that to me is very important.
Thank you, Health Minister. Here's to making science popular again and explaining it to everyone and making it something that everyone is well informed and can use to keep themselves protected. We have to stop here because we're out of time, but please watch all our channels. We will keep you updated on what's happening at the World Health Assembly. Until next time then, bye-bye.